In this video we are going to discuss regarding eye. So I am going to draw an image of the eye and relating with this thing. So there is like optic, we have optic knob, optic knob, optic nerve, and it is like pure sensory nerve, pure sensory. So before going to test optic nerve, it's penetrating inside the sclera. This is forming sclera, and after the sclera there is a cornea. Okay, so we are moving on. Like when we look, there is this is a sclera or fibrous layer. So it is like 5/6 part of the eyeball. And when we look at the cornea, so this is our cornea. This is our cornea. Okay, it is transparent. So it is cornea. It is one of the sixth part of the eyeball, and so when we look this inside this is like our sclera region, sclera. After that, inside the sclera there is retinal layer. This is retinal layer, and going to the fiber, this is the retinal layer. This is the retina, and it is like sensory. It is like here is the when the ray of the fall in the retina, and then image formation occur. So in this there is like ciliary body, ciliary muscle, and then iris, and this forming the iridio. This is iris muscle, this is iris and ciliary muscle. So when we look, this is the iris, this is the ciliary muscle, ciliary portion, and this is the iris. When we look at the another view of the image, like when we look at the eye in front of, so this is the eye, our eye, and when we look at the eye, like iris, when it is like this is the pupil, and this pupil is like forming there is like this is the iris muscle, and this is the iris muscle. And when we are looking, this is the lens. Inside that there is a lens, and then there is passing of the light. So this is the iris muscle, which is controlling the constructing the pupil, or here is the like we look as a diameter here. So it's controlling this diameter of the pupil. Control the diameter of pupil. And after that, from this ciliary, there is a suspensory ligament that are holding the lens. This is suspensory ligament, and this is holding the lens. This is suspensory ligament and holding the lens. The size of lens, like decreasing or increasing, like there is lens making the like flat or the like spherical by this this ligament. And when the iris is contact, or this when the ciliary muscle is contact or relax, that control the change of the change the lens of diameter, or the lens shape of the lens. So that's help in the accommodation. So changing the lens, changing the shape of lens, known as accommodation. Which help to the like where to image form is like the image is, the object is near or far, which can draw the image inside the retina. After that, this is the retina. Retina is a thin layer of it is formed by 10 layers. So in the retina there is like rod and cone layers. So I'm not going to describe regarding all 10 layers. So there is a here is a 10 layers. The retina is formed by 10 layers, and cornea is formed by the 5 layers. When you look the eye, so in between the lens and in the retina, it is filled with the fluid. It is filled out of fluid. This fluid is known as a gel-like substance. It is a gel-like substance. So it is known as vitreous humor. Vitreous humor, and a substance that is filled inside the anterior to the lens and in between the cornea, lens in between the lens and the cornea. So this is known as aqueous humor. This is basically the formation of eye. So when you look like any objects, so when the ray is passing and going and it's forming the like image on the like retina, and when the retina forming the image, and like when you look, if is forming a image on the retina, and that causes like when this light are coming and going and drawing the image on the retina. So there there is a stimulation of the nerve fibers, and these nerve fibers, optic nerve fibers, are the stimulated, and they to go inside our brain and in the occipital lobe. So occipital lobe like analyze the image and interpret it. So this is regarding the eye, structure of eye. So when you look, there is like pupillary reflex. So at the night, like it at the night or dim light, there is like wider pupil. So this increase the diameter of the pupil, and when you look, this is increasing diameter, and in the light there is a less light, or in the daytime or more light time, in the more daytime there is a like narrow of the pupil, and it is like action of the parasympathetic or sympathetic action. So controlling the ciliary muscles. And when you look regarding in the like brain, so vertebral pons, cerebellum, medulla. So this region is the occipital lobe, which is associated with the like there is like their region for the vision. And when you look the like movement, like when the muscle, there is like muscle. So this is the eye, and there is a some muscle, like there is a in the medial side, or nose side. When you look in the nose side, there is a muscle known as medial rectus. In the superior side there is superior rectus. In the lateral side, lateral rectus, and inferior rectus, and superior, there is a superior oblique rectus and inferior oblique rectus. This is inferior oblique rectus, superior oblique rectus. So these are the like these muscle help to the holding the eyes, and also movement of the eye, and it's present in the orbits. And when you look the like arterial supply, there is like ophthalmic artery, ophthalmic artery which supply the eyes. So this is all regarding the simple overview of the eye. And